Last year I didn't make that much. I've heard about exchanges. Can you tell me about those options?
Starting in 2014, health insurance coverage will be available through the Healthcare Exchange, also known as Health Insurance Marketplace. You may be eligible for a government subsidy that could help you pay for insurance. Subsidies may be available for individuals who make more than the federal poverty level. Different subsidy levels will be available based on annual income and other factors.
Hi, I'm Pamela Gentry at the Centers for Medicare and Medicaid Services, and if you've got a minute, I have some important information to share with you about this year's Medicare open enrollment. It began on October 15th and ends on December 7th, so now's the time to look at all the Medicare plans available for 2013. Compare them to your current Medicare coverage and choose what's best for you. Happy with your current coverage? You don't have to change a thing. But it's always good to look in case you find better coverage, lower cost, or both. And check out the preventive benefits and savings you get because of the healthcare law, including a free yearly wellness visit, some cancer screenings, and over 50% off brand name prescription drugs if you're in the donut hole. Now's the time for Medicare open enrollment. Use the free information and tools at medicare.gov. You can call 1-800-MEDICARE or refer to the
I just graduated from college and I have a ton of student loans to pay off. So buying insurance isn't really an option for me right now. In fact, I'm moving back home with my family to save money until I find a full-time job. Are there any parts of the new law that can help someone like me?
Yes. The new healthcare law allows parents to continue to carry their children under their plan until they're 26. So ask your parents to check with their company or directly with their insurance provider to find out more details about how you can be insured. However, if that's not an option, you can purchase individual coverage and you may qualify for a subsidy. Starting in 2014, every individual will be required to have health insurance coverage or face a penalty. If you call Blue Cross and Blue Shield of Alabama, we can direct you to a plan that provides the coverage and services that you need.
Hola, soy Teresa Niño de los Centros de Servicios de Medicare y Medicaid. Hoy le tengo información importante sobre el mes de la prevención de cáncer del cuello uterino. ¿Sabían que todas las mujeres tienen riesgo de contraer cáncer de cuello uterino? Y que este cáncer se presenta con más frecuencia en mujeres mayores de 30 años de edad. Anualmente, cerca de 12,000 mujeres contraen cáncer del cuello uterino en los Estados Unidos. Pero con exámenes de detección, con regularidad y seguimiento de las instrucciones de su doctor, este es el cáncer femenino más fácil de prevenir. Existen 2 exámenes de detección que le pueden ayudar a prevenir o detectar este cáncer en las primeras etapas. La prueba de Papa Nicolau identifica los precánceres. Estos son cambios en las células del cuello uterino que pueden convertirse en cáncer si no se tratan en forma adecuada. La prueba del VPH identifica el virus del papiloma humano que puede causar este tipo de cambios celulares. La prueba de Papa Nicolau es recomendada para todas las mujeres entre las edades de 21 a 65 años. Y es bueno saber que todas las mujeres con Medicare tienen esta cobertura. La parte B de Medicare cubre las pruebas Papa Nicolau y de exploración pélvica, una vez cada 24 meses para todas las mujeres, una vez cada 12 meses si corre un alto riesgo de contraer este cáncer de cuello del útero o vaginal, o si está en edad reproductiva y ha tenido un resultado de Papa Nicolau anormal en los últimos 36 meses.
I've heard about subsidies, money that could help me get better insurance coverage for my family. Can you tell me more about them?
For people who purchase their own health insurance, that is, they don't get it through the company where they work, starting in 2014, they will be able to purchase coverage through an exchange, and subsidies will be available on a sliding scale to help individuals or families with incomes up to 400% of the federal poverty level. The Congressional Budget Office estimates that about 20 million American households will be eligible for subsidies.
Right now, my family and I have health insurance through my work, a large energy company with hundreds of employees. When it comes to the changes in health care, do I need to do anything?
No. The new law will be implemented over the next several years. We will continue to provide the best service possible and will work tirelessly to implement the new healthcare law to best serve our customers. We are reviewing the law and working with federal and state agencies to ensure smooth transitions for our customers.
I'm a mom and married with 2 kids. My husband gets our health insurance through his employer, a large company with several hundred employees. So I was wondering, will healthcare reform affect us?
It's possible you may see some changes to your current health plan coverage, such as premium costs, deductibles, co-pays, or co-insurance. But please know that Blue Cross and Blue Shield of Alabama will keep you informed. We will work directly with your husband's employer to make sure you have the latest information about healthcare reform and how it affects your family's policy.
My wife and I are worried we'll be bringing home less money because of healthcare reform. Is that likely?
You may be paying more since there are some new taxes and fees. In 2013, a married couple making more than $250,000 a year will now pay a Medicare payroll tax of 2.35%. That's up from the current 1.45%. In addition, those in the highest income tax bracket will pay a 3.8% tax on unearned income, such as dividends and interest.
The following program is brought to you with limited commercial interruption by J.C. Penney.
Here's a sneak peek at tonight's AFV. We dare you not to laugh. Welcome to America's funniest home videos. And now, here he is, the host of AFV,
for that athletic introduction. Welcome to AFV. You know, for over 20 years, we've brought you pure, 100% all-natural entertainment. None of the people in our videos could ever be accused of taking performance enhancers. The good news is they'll never have to confess to Oprah.